Hi everyone, welcome to Medicine Note YouTube channel. In this video, we are going to see about blood supply of face. The face is richly supplied by facial artery, transverse facial artery, and small branches of ophthalmic, maxillary, and superficial temporal arteries. These are the arteries which supplies the face. Now we will see about the facial artery. The facial artery is the chief artery of the face, and it is a branch of external carotid artery, and in cervical course it passes through submandibular region and enters the face. The facial artery is a chief artery which supplies the face. It branches from the external carotid artery. In cervical course it passes through submandibular region of enters the face. The facial artery is also known as anesthetic artery. It enters the face by entering the mandible and pierces by the deep cervical fascia and the masseter muscle. First, it runs upward and forward to the 1.25 cm to the lateral angle of the mouth and ascends by the side of the nose as medial angle of an eye and terminates by supplying the lacrimal gland. Now I will show the image for better understanding how it enters and how it leaves. This is the external carotid artery. It is a branch of the facial artery. It is a branch of external carotid artery which supplies the chief face. First it enters into the mandible as well as supplies the submandibular region. Here is the submandibular region and enters above and to the angle of the mouth. From here to the distance of the artery is 2.5 cm and gives a branch is inferior labial as well as superior labial and ascends lateral nasal and ascends an angular vein and supplies the lacrimal gland which is present near the eye. This is the course of the facial artery. It ends by supplying the lacrimal gland as you seen in the image. The facial artery is very tortuous and it lies between superficial and deep muscle of the face. There are the branches of the facial artery are superior labial, inferior labial and nasal. These are the branches of the facial artery. A small branch anastomosis with the and transverse facial artery and infraorbital artery and at the medial angle of the eye. The facial artery anastomosis with the ophthalmic artery. In the medial angle of the eye, the facial artery anastomosis with the ophthalmic artery. Here is where the place the external carotid artery as well as the internal carotid artery meets. Here is the place in which the external and internal carotid artery meets, by which the facial artery as well as anastomosis with the ophthalmic artery. Transverse facial artery, a small artery which is a branch of superficial temporal artery, emerges from the parotid gland and runs towards and over the masseter deep to parotid. It emerges from the parotid gland, runs deep to the parotid gland as well as deep to masseter and buccal branch of the facial nerve and supplies the parotid gland duct of masseter overlying skin. It supplies parotid gland and its duct as well as the masseter and overlying skin. This is the transverse facial artery. Here it is the transverse facial artery. Here is the maxillary artery. It is a branch of external carotid artery. Here it comes from this is the vague artery which supplies the face, which is known as facial artery. Here the supraorbital and supratracheal is the branch of ophthalmic artery. It is a branch of external carotid artery. The facial artery, as we see in here, it is an external carotid artery. It comes from the external carotid artery. The supratracheal supraorbital is a branch of internal carotid artery. Here is where the medial angle of the eye, the external carotid artery and internal carotid artery meet each other. Thank you. For more videos, please to like, share and subscribe. For doubt, please to comment in my comment box. For new videos, if you want, please request in the comment box. Thank you.